As we're talking about autoimmunity this month, I have to make sure I talk about vitamin D. Vitamin D is something that we get from the sun exposure to the sun on our tissues that doesn't have sunscreen, okay? What happens is anywhere you see blood vessels, as the sun hits that blood vessel, in there is cholesterol. This is one of the sneaky reasons your cholesterol can be high, is if your vitamin D is low, because it's flooding the body hoping to get any little speck of UV exposure on those areas. As the sun, UVB, hits the blood vessel and there's cholesterol present, it actually turns into cholecalciferol, which then gets converted in the liver to vitamin D. Vitamin D is a prohormone. It's really important for your immune system. And what happens is your little T regulatory cells that regulate your immune system, when they're told to turn on, they look around for vitamin D, and if they don't find it, they can't function properly. And if you're autoimmune, you need to have a really good and robust vitamin D. 80 to 100 nanograms per deciliter on your blood test is ideal. And I think the range is 30, right? Is the low, it says you're normal. But I occasionally find that to be normal when somebody's in their 30s, because it is specific to each patient. But in general, you can certainly look and see, do you have enough vitamin D? And get it up with supplementation of vitamin D in a fat-soluble form, not powdered. And your body then will convert that. And through the winter, everybody really, if you're in a northern latitude, you need it. Now, vitamin D from the sun is the best form, because your body producing things is always the best way, right? And you need 10 to 15 minutes. You don't ever want to burn, but you need regular sunshine every day. Morning sun is the best. And if you get outside and you get some morning sun, what happens is it hits a part of your brain called the tentorium and elevates your serotonin. It also gives you a nice shot of vitamin D for the day. Remember, your body being the best producer of anything that it needs, hormones, vitamin D, anything, and it helps elevate that. So make sure, especially from March through November, if you're in the northern latitudes, you get your sun every day. If you're in the southern latitudes, then you have a longer season where you can get your vitamin D from the sun. And the darker your skin, the more melanin that you have that blocks UVB, it's to protect you, the more you need vitamin D supplementation. So really important to look at your vitamin D on lab every year, especially in the springtime, because that'll tell you how far down you're getting in the winter. Okay, but you want to have a robust and high level of reserve of vitamin D for good function of your immune system. I hope that's helpful.